Joining us today is Krista Daggio-Ludwig, a board-certified women's health nurse practitioner. Krista, thank you so much for joining us.
Thank you for having me.
We have a lot to cover in this segment. Okay, so when we talk about women's cervical health, there's so many different things. There's the HPV vaccine, screenings. Talk a little bit about what's important.
So when it comes to women's cervical health, it's very important that women go to their gynecologist to get pap smears. We start doing pap smears at age 21. HPV stands for human papillomavirus. We start screening for that at age 30. Unless when you're younger, if any abnormal paps come back, we'll then reflex to see if HPV is the problem, because HPV is what is directly linked to cervical cancer.
Oh, interesting. And then when it comes to screenings, there are a lot of them, right?
For HPV? Mm-hmm. So there's only one particular...
Or just in general, yeah.
Okay. So there's cervical cancer screenings with pap smears. There's breast cancer screenings. We do mammograms, colon cancer screenings. Even getting your blood pressure taken is very important, because heart disease is the #1 cause of death in women. So a lot of people think it's breast cancer, but just even getting your blood pressure checked is super important.
Speaking of breast cancer, what should a woman be doing, at various stages of her life to get checked out?
So we do recommend baseline mammography starting at age 40. In regards to self-breast exams, we've kind of gone away from them, and we talk more about self-breast awareness. So in other words, we don't want somebody always looking for lumps on their breast. We just want them to be familiar with their breast, so if anything new or different pops up, they'd be able to point it out to us, and then we can order the appropriate imaging to make sure it's getting taken care of.
And we can't forget about prenatal care. That's a biggie.
Prenatal care is crucial. There are so many dimensions of prenatal care. I think a lot of people miss how in-depth it is, but it's on so many levels. Obviously caring for the mom, the baby, what we always say, what mom eats, baby's eating. Nutritional counseling, making sure they get to the right high-risk doctors right away if they're high risk. Obviously, we also do first trimester ultrasound, so if they don't know when their last period was or have no idea how far along they are, we can usually help with that. But, we always say the earlier you come to prenatal care, healthy mom, healthy baby.
Right. It's really important to make those appointments.
Yes.
You don't want to see somebody right at the end.
No, we don't like when people show up to the hospital in labor and they have no prenatal.
You'll be fine. Everything will be good, but you'd rather they come all the time.
Yeah.
All right. Krista, thank you so much for joining us on Community Connection.
Yes, thank you so much for having me.